Hi, this is Dr. Matt Rasmussen at Periodontics and Implant Dentistry, Tallahassee. We're getting a lot of questions regarding tooth extractions. I want to go through some of the most common questions we were seeing here recently at the office. A dental extraction is when a tooth is removed from the oral cavity. Usually this is done for one of a couple of reasons. Either there's some form of disease process that's made the tooth what is referred to as being non-restorable, either a large cavity or gum disease problem, or there are times where a tooth is removed for functional reasons that patients can be getting braces, there's not enough space, so a tooth is sacrificed to create the space available. A root canal is a procedure that's done to work on the nerve of the tooth when it's been irreversibly damaged. This procedure is only indicated if the remaining portion of the tooth is still a savable tooth. So a root canal is indicated in a different situation than a dental extraction. An extraction is usually recommended when some type of disease process is made to the point where the tooth is no longer a savable tooth, and therefore it's better to be removed and then look at a tooth replacement option after that tooth is indeed extracted. When there's an infected tooth, you have to remember there's not only the infection on the tooth itself, but many times there's infection in the surrounding area as well. That's why it's important when a tooth extraction is performed that all appropriate precautions are taken and the patient takes appropriate medications as indicated as well after the procedure. Not all patients who get braces need teeth extracted. However, there are times when orthodontists may recommend that teeth be extracted specifically to create room in the mouth for the remaining teeth once the teeth are straightened. Periodontal disease is a condition that affects the surrounding structures around a tooth or around the entire dentition. If a tooth is removed, it is true that tooth in theory no longer has periodontal disease because the tooth is now gone. However, removing a tooth or two teeth is not a cure for periodontal disease. So in addition to a poor tooth being removed, we also need to do other indicated treatments to make sure that the periodontal disease is managed appropriately. A dental implant is a tooth replacement option that uses a fixed structure inside of the bone that eventually holds on to what looks like another natural tooth and can function in a very similar way. For this reason, the tooth would have to be extracted prior to the dental implant being placed, or there would be an area where that tooth had never formed. But in either situation, a dental implant is used to replace a space where the tooth is indeed missing. During a tooth extraction, our goal is to make sure that the patient's always comfortable in the chair. So prior to the extraction being performed, we make sure that the patient's numb and make sure that the patient cannot feel significant pain during the procedure. That being said, there's always pressure that you'll feel during the actual extraction process, but you should be comfortable throughout the procedure. A bone graft is a material that's placed into the area where the tooth has been extracted. In many situations, this is indicated to protect the area and to also allow for the best replacement options for that tooth. However, in some situations, it may be better not to perform a bone graft. These specifics can be discussed at the time of the exam. One of our primary goals with any procedure that we perform is to make sure the patient is as comfortable as possible in the chair. In all situations, our goal is to make sure the area is as numb as we can get it to make sure the patient is indeed comfortable. However, sometimes some discomfort is felt during the extraction process. There are a number of things that we do prior to and of the day of the procedure to minimize the likelihood of any pain during a dental extraction. During a tooth extraction, the patient's always going to be having local anesthesia, which is numbing of the area. Many times we'll have a patient on antibiotics ahead of time as well to reduce the level of infection at the time of the procedure. There are other sedation options available as well, one of which is known as laughing gas, which is inhalation sedation. There's also oral sedation in our office that's available, which is known as anxiolysis, again, commonly known as oral sedation. In more larger reconstructive procedures, other surgeons may have things via IV or in a more controlled setting like in a hospital, that's not typically used for something like a single tooth extraction. After the extraction process, we want to make sure the patient's comfortable and the area heals appropriately. Therefore, a number of medications will be prescribed post-procedure. Some of these medications are to help relieve the pain or discomfort after the procedure. Many times an antibiotic will be prescribed as well to make sure that no infection comes to the area. The most common question that we get when it comes to healing after a procedure is how long is the patient going to be sore? Typically, the most sore day is typically 2 days after a procedure. So usually we tell a patient 2 to 3 days up, 2 to 3 days back down as far as any soreness. Many patients report very minimal post-op discomfort with extraction. There are a number of things the patient can do to help the tooth extraction heal faster. We typically go over all of these in more detail at a pre-surgical appointment here in the office. Some of the basics that can be done, though, is to take all pain medications and antibiotics as prescribed and to use any kind of mouth rinse that's been prescribed as indicated. Also want to avoid any kind of activities that can harm the healing process. The most common of these is smoking. There are certain things that a patient can do after a procedure that will cause the bleeding to increase. If we want to decrease the likelihood that there's any bleeding post-procedure, we want to try to avoid these as best as possible. The most common of these is to not do anything that's going to cause a vacuum in the mouth, such as drinking through a straw or smoking. Staying away from carbonated beverages and going through other indicated rinses and things like that will also help. A blood clot is a natural part of the healing process. If that blood clot is indeed lost, that means that the area will have to reform a blood clot again to prevent the bleeding from continuing to occur. The most common precautions are just to take all medications as prescribed, ice during the initial healing phase, and to rest and take it relatively easy. The better that the patient does as far as resting and getting adequate nutrition on board for the first few days, the better the patient will typically heal over time. We recommend that the patient not do anything that's going to cause a raising of the blood pressure in the immediate postoperative healing phase after a dental extraction. When a tooth is lost, it is possible that the patient notices a difference in speech after the procedure. This typically depends on the location of the tooth and how many teeth are indeed missing. I hope we've been able to answer some of your questions regarding tooth extraction. If you've been told that a tooth extraction is indeed indicated, it's important to get in and see us as soon as possible because the concerns can become greater over time. Remember that the infected tooth can cause additional concerns in spreading of the infection further. So please give us a call at area code 850-692-9200 to schedule an appointment today.